Okay. Here in Cameroon, I'm working for the Pro-PASSaR. Pro-PASSaR is just like the health project of the GIZ in Cameroon. Yes, I saw in the invitation that it was there was other partners not working with openIMIS. So I think in some part I'm going to go maybe in more details for those partners. So, I'm sorry, Constance, little bit changed the agenda. I removed one point and I just introduced that point in the openIMIS in Cameroon. So the agenda is the introduction, openIMIS in Cameroon. So openIMIS for universal health coverage in Cameroon, the SWOT analysis and the next steps. So for the introduction, all of us already know openIMIS is an open source to manage universal health coverage and social protection, so insurance thematic. So it's supported by a very strong community of developer users and implementers. So what are the main function or the main function we can use in openIMIS. In openIMIS, we can use the enrollment, the health services, the claim management, and the monitoring and evaluation. This is the four big modules we are implementing and using in openIMIS. This is not just like remember, openIMIS open source. Why this system is so interesting for us is the part of the interoperability with openIMIS can communicate with many other systems. openIMIS is sustainable, and the customization of openIMIS with openIMIS we can customize many different schemes or finance schemas. So this is a little bit the histories of openIMIS itself. So starting in 2012 until today, this is the one of openIMIS for the community. The openIMIS is still be developed, and I think I didn't actualize the last part, but this is the history of openIMIS, the software itself, not the part in Cameroon. So now come to Cameroon. So openIMIS started in Cameroon in 2013. It was implemented by BEPFA. So Bamenda Ecclesiastic Province Health Assistant for Community-Based Micro Health Insurance Schemas. After that, in 2017, they had a master version of openIMIS, always for the same project, the BEPFA project. And in 2020, we had two new implementation of openIMIS, one for high FAO user fees exemption and the other one for educate. Educate was a sort of conditional cash transfer scheme to support children of targeted households for their education. In 2022, we had another implementation for community health monitoring with USAID in Cameroon. In the same year, we started to configure openIMIS for the Check Santé in Cameroon. Check Santé is like an insurance voucher for reproductive health or for to fight against maternal mortality in Cameroon. At the same time, we have the MINAS in Cameroon trying to implement openIMIS too. So in 2023, the Pro-PASSaR made a pilot project about psychosocial support on IDPs, internal displaced person, to try to reimburse the services offered to internal displaced person. And in the same year, we started to configure openIMIS for the universal health coverage Cameroon. So one of the implementation of openIMIS in Cameroon was this project, this IDP project. Like I already mentioned, is a project, a psychosocial support project for IDPs, and it was implemented in 4 regions in Cameroon. Not all how can I say, not all the region, because it was just a pilot. So in the 4 regions, we had to work with some NGOs. We were aware to work directly with the IDP. So there was the one giving the services to the IDP and claiming it in openIMIS at the end. So the other pilot project we made in openIMIS was to try to claim the birth registration in Cameroon. We finished with this project ended, I think, last week, and it was about to try to claim or to reimburse or to buy the birth registration, because in Cameroon the birth registration was very low. So we think about the project, how we can claim those birth registration directly in openIMIS, so that the health facility can get reimbursed for what they invest to the birth registration. And that project was made, was coordinated with PAMEC under the finance of the sector network for population dynamic, reproductive health and right. So the next step of that project was we tried to redesign the project, not to redesign the project, maybe to against the project, to complete the project or to bring more context in it, by trying to put in place a standardization of the communication between a eCFVS and openIMIS. And we proposed this project to the to the Innovation Fund 2024, and we were lucky and we get the finance for that. So right now we are designing standards for interoperability processes between OpenCFVS and openIMIS. But when I speak here for OpenCFVS, we are trying to do that for all the eCFVS. So to put in place one standard which can work with all the eCFVS and not just OpenCFVS. So then the work, you can see there the partners working on the project. So Pro-PASSaR from Cameroon, we have the support of health sector strategy in Nepal, we have PAMEC, the civil sector modernization support program in Cameroon, we have the sector network for population dynamic in Germany, we have the global initiative for social protection. This is all the teams involved in this project. So coming here to openIMIS for the universal health coverage in Cameroon. So how did this start? Like I already mentioned in the history in Cameroon, we had already some implementation of openIMIS in Cameroon. So we had the implementation in the openIMIS HIV implementation, we have the openIMIS Check Santé implementation. So the second one here in the middle. When we start in 2023, we implement another standalone openIMIS CSU, which I call unique. So the openIMIS HIV was normally working on was used to claim the HIV bills or services. The openIMIS Check Santé was used to claim the reproductive health services. And we had that openIMIS unique, is the name I give to that part. We were used just to claim the tuberculosis, the hemodialysis, and the consultation for children under 5 years. And we had to bring all that system together to have a unique openIMIS. What is the openIMIS CSU? So openIMIS Universal Health Coverage. CSU is the French word of that. So in this openIMIS, we are claiming 5 different service packages, and it's that 5 different service packages are the 5 different service packages for the universal health coverage in Cameroon for the moment. So the phase 1 of the project is to begin with 5 service packages, and that 5 service packages, like I already mentioned, is the Check Santé, the VIH, HIV, the tuberculosis, hemodialysis, and the consultation for children under 5 years. So what is the architecture of that of the information system of the universal coverage for the moment. So here I'm not saying we didn't take all the system which are available. We just mention the system we are using right now in focus with openIMIS. So openIMIS working with
Recording is on.
we have openIMIS working with camera health system, and we have openIMIS working with Metabase. How did it work? We have a local system for enrollment here. It's the camera health system. The camera health system is still the one producing the MPI, the master patient index, and sending it to openIMIS. And we have a duplicate database for openIMIS with Metabase, and with Metabase we can just analyze all the data. So we transfer all the data from Camera to Metabase and for openIMIS to Metabase to be able to analyze them and to compare them. So this is a screenshot of camera health. With this system, we can collect all the demographic data of the beneficiaries, from names, everything we need, and all the data will be analyzed first of all and confirmed. And after this, the data are confirmed. Confirmed, it means there are no duplication of this person or this beneficiary. It will automatically generate the MPI, and that MPI will be sent to cameras. This is the enrollment process. So in openIMIS, we are able to find out this MPI or the beneficiary and claim and do the claim process on it. So attribute the policies to the beneficiary and do all the claim processes validate the bill and extract them or print them out. So the last part we have is Metabase. Here you have a small representation of some bills rejected. You have a mini dashboard for that to be able to compare how many bills have been made, how many bills have been made and rejected, and so on. How many beneficiaries have been recorded for us to compare and to do some the monitoring of all ongoing processes and evaluation for the bill at the end. So right now in openIMIS, we have about something like 250,000 of claim. Here I mentioned rejected claim, ongoing claim, treated claim. So it's just the total of all the claims you have in openIMIS. We have about 1,800 users in openIMIS right now working. I must say we have to check because we created some account for the different user, but we changed it. Some user are sent in other facility which are not using openIMIS for the moment. So we still have some lag like that in the system. So we have to deactivate. But it's about 1,800 users in openIMIS right now. In Cameroon, we have already trained 600 health facilities which are using openIMIS since I think, if I remember well, is last year. I don't know the month, but I think something like August or September from last year. So how are we working? How is the working process? We work after training the health facility. We actually working by coaching them through WhatsApp. We have many WhatsApp group for each region where any users can post his problem, so we can directly respond in the group or call them if the problem is a little bit complicated. So we had a weekly online training and coaching. It was all, I think, in the afternoon. We stopped with that at the beginning of this year, but we realized that it's really important to continue with those weekly training, online training. So we are starting now with the online training to coach the user who attend or who need some course, more coaches. We created we created some video tutorial that we posted on YouTube, and the user have access to that video so that they can review or train themselves to be able to claim in openIMIS. So how is it work? What is the process? The different actors we have the users. After that, we have at the first level the district manager. They are the one directly in contact with the users in the health facility. They are the one coaching them directly on the field, helping them and doing the first report. So after that, we have the regional fund for health promotion. Is the third part in charge of paying the bill, if I can say like that, or in charge of validating the different bills. They also have access to all the WhatsApp groups so that they can manage or try to do the first report. At the third level, we have the National Technical Committee of Universal Health Coverage and the IT unit of the Ministry of Health. They are doing the second level support, the feedback, and some configuration, because we have already hand up one part of the configuration of openIMIS to the ministry so that they can, how can I say, they can already try or they can already configure creating account, maybe I cannot say under our supervision, but in collaboration. So the fourth level is BID. BID is one organization leading by Josh. I think some of you already know Josh. They are the one in charge of coaching, of training, of configuration. We have Ynode. Ynode is a developer enterprise here in Cameroon, the local enterprise in charge of developing any other service, any other function we need, and the GIZ supporting all the partners like they can. We are at the level of the third level support, fixing all the bugs and um, yes, preparing all the trainings. At the fifth level, we have the fourth level support is Swiss CPH. So everything directly in regard to the community, to the openIMIS community, is managed at this level. So what do we plan for openIMIS for the universal health coverage? What we are doing right now, we are continuing to configure the openIMIS because we still have a lot of requests coming from different users, from the health facility users, from the regional fund for health promotion users who are asking for new function in openIMIS. So we are working with the ministry to validate those requests and to try to implement them. Outside them, sorry, it was in German. So we are we are preparing a small webinar. I think it will be in Nepal to talk about the technical implementation, particularly to regard to the server performance, because here in Cameroon we have a really difficult period where our the openIMIS server performance were really down, and we try to fix it like we can't by adding the CPU, the RAM, everything. So right now, I think we got back to a normal process or normal performance of the server, but we still have to speak with other colleagues, with other implementer, I think, to see how they configure their server and what they are using, just to be sure that we will not face that problem again. And the third part, the biggest part we are planning this year, is to upgrade openIMIS. Until today, we were still using the 10 version, the 2022.10 version of openIMIS. So we are planning to upgrade openIMIS to the 2024.4 version. So as slot analysis, I was trained. I will not read all of them, just maybe the support of GIZ on openIMIS, the availability of a local private expertise. This is really important to be faster, to have direct in-person meeting with them, on some time for them to discuss maybe directly with with some actors of the ministry to get really what they want to achieve. We are working in we are doing a different meeting directly with the ministry and the local developer, and this is really helpful for our implementation. A weakness, we had a problem at the beginning with openIMIS is that we didn't have, and we still didn't have, a master facility list, right, what is really important for all the locations. We didn't have a master product list, and we have a master patient index, but we are still working on this master patient index because he's not trained enough to work offline. So that is the one of the weakness we have for the moment. Like I already said, the server performance, we still have to work on the server performance to be sure that we not face those problems again. So the opportunity we have, like I said, we just read some of them, is the growing interest from from other partners, technical and finance partner, to the digitalization and to the universal health coverage. So the international, and we found that there are some international funding available, but we still have to fund them, to collect them, to improve what we are doing here in Cameroon. The strength we have is the lack of electricity in some area and lack of internet in some area. I forget something there. In some others area we have internet, but the user are not they're not able to use openIMIS properly, because we think the quality of internet they are getting there in the field is not enough to open openIMIS or to work in openIMIS. So right now we are thinking about how we can evaluate that. What we don't know is the quality, or yes, the quality of internet we need to start openIMIS. This is one evaluation we want to make, and we didn't know if other partners already work on this, on that. We can see, for example, you had some health facility getting like 2 megabit per second in download and 4 in upload, and they are not able to openIMIS or to claim in openIMIS. So we want to know what did they really need, what the health facility really needs as internet quality to be able to work in openIMIS. So we can set up that like standards in Cameroon and say, hey, to the national providers, say, hey, in this region we don't have this capacity, and we need this capacity of internet to be able to use the system. That is what one of the problems you have, and we are trying to solve right now. So speaking about next step, it's just this design. If you remember, the first information system architecture I showed you at the beginning didn't have openIMIS in the middle. So the interoperability was a direct connection between Camel Health and openIMIS. So our next step is to think about to think about putting openIMIS in the middle of all of that as interoperability platform, so that the communication can be more can be more efficient, and we will not have some problem we have now, that we have to always work on both of system when we have to do changes. Look a little bit bigger. This is what we can achieve at the end, maybe. Always with openIMIS, what we want to do, or what we are thinking, and we are looking finance to do so, is to have a ECFVS system. Which can do the birth declaration and send the information to openIMIS, so that the baby or the beneficiary can automatically be enrolled in the system Camel Health. The MPI can directly be generated and sent into openIMIS. So we will not have to go manually and enroll a baby in the future, and enroll a baby in the software Camel Health. The open him we have us also to transmit to DHIS2 all the statistic data. Uh, talking about master product list, talking about supply chain management, we have the opportunity to link maybe open LMIS to openIMIS so that the information can be exchanged through openIMIS without problem, and the configuration of the one in charge of the logistic, they can easily work in open LMIS, and the information can just be updated in openIMIS without working in both systems. So we have down there other system can be linked to openhim and transfer their data directly to Cameroon or to openIMIS. Other in with other system, I mean EMR, for example, and other BAMNI system already in place in Cameroon. So this is what we are seeing for the maybe for the future, but it still needs to be confirmed, to be validated by the Ministry of Health, and we still need to find some funds, some finance to be able to put this in place. So thank you very much for your attention. And then questions.